So last year we were very pleased that our over 65-year-olds had all had their flu vaccinations and we'd reached target. However, we hadn't reached target on the under 65s. So this year the practice set itself a target to vaccinate our under 65s as well and deliver all our 480 vaccinations by the end of December. We've been running a flu campaign for many years, but this year we wanted to do some more planning around it using the Plan, Do, Study, Act cycle, because the landscape has changed quite a lot in the last few years, with pharmacists also giving flu injections to patients. And what we noticed was that, of course, with the pharmacy appointments, there is no need for the patient to book an appointment ahead of time. They can just pop in and have a flu jab. And we wondered if having GP appointments was a bit restrictive for patients and whether that was contributing to us not meeting the targets. So we did some planning with the team and we decided that our practice nurse has 2 sessions of management time where she undertakes the infection control audits, and she very kindly offered to actually immunise any patient that would walk in on those 2 sessions requesting a flu jab, just to make access much easier for patients. We also decided that for our diabetic population, which is a very large register, we would really start actively ringing and recalling them first, and also ringing our over 65 patients who are very vulnerable and trying to get them have their jabs early in the year. So Rima, what sort of things did you do to try and increase our flu vaccination targets and get the patients in?
I spoke to the reception manager, so she put a clinic up for me, morning clinics and afternoon clinics. So there's appointments available for patients that want to come in the morning, come in the afternoon to have the flu vaccination, so it's easier access for them. They're able to come in. And I had 5-minute appointments, and patients that did come in for long-term condition reviews to see me, if they were entitled to have the flu vaccination, I was happy to give it to them when they did have an appointment to see me, instead of having to rebook them for a flu clinic. So it saves appointment and the time as well. The doctor's appointments, when patients did have appointments with telephone consultation, I will go into their record, go and check on their records to see if they were entitled to have a flu vaccination. If they were, then I would call them, book them an appointment for them to come in to have a flu vaccination.
Oh, so that way we got all the patients that had doctor's appointments as well. Yeah.
And if patients did come to reception also, reception will call me and let me know this patient has diabetes, they're entitled to have a flu vaccination, and if I was happy to give it to them.
So going into the study stage of the Plan, Do, Study, Act cycle, in the last 4 weeks we've given 180 flu vaccinations. The walk-in clinics haven't had the number of patients coming through as we expected it would. However, we don't want to change this at the moment as it is new and 4 weeks is a short time. So we're going to continue to study the numbers of people walking in, and we're going to advertise this more and keep looking at the study phase and then act accordingly.